And welcome to Hannity in the Obamacare rollout disaster. Now, tonight it appears the president is altering his job description. He's now the salesman in chief because earlier today he spoke in the Rose Garden and he tried to convince you, the American people, that this health care law is still a good idea despite the train wreck of a rollout. Watch this.
Through the marketplaces, you can get health insurance for what may be the equivalent of your cell phone bill. The product, the health insurance, is good. The prices are good. It is a good deal. People don't just want it, they're showing up to buy it. Nobody's madder than me about the fact that the website isn't working as well as it should, which means it's going to get fixed.
3 years, $634 million of your hard-earned tax dollars, but unfortunately that's not all. The president continued to push the Democratic-fueled talking points, which have been pushed since October 1, and that is these computer glitches happen because too many people are trying to log on at once. He isn't alone in that talking point. Watch the talking point bouncing ball.
The number of people who visited the site has been overwhelming, which has aggravated some of these underlying problems.
There has been unexpectedly high levels of interest, and we are taking action every day. That is the principal reason that there's a problem.
It is not unique that when you have a very large new software program come out, that people work to clean it up. I usually wait till it's 0.3 or 0.4 before I sign up. So many millions of people rush to get in because that shows how much interest there is.
It is true that what's happened is the website got overwhelmed by the volume.
The biggest challenge we have today around America is keeping our websites up because of the volume. If this doesn't show the hunger the American people have to sign up for health care, I don't know what does.
We found out that there have been times this morning where the site's been running more slowly than it normally will. The reason is because more than 1 million people visited healthcare.gov before 7 in the morning.
All right, why can't they just be honest? Report after report indicates this has nothing to do with the number of people trying to log into that website. There are a dozen other reasons, including the fact that some reports indicate they used 10-year-old technology and the software wasn't tested until a week before the launch. But no matter how hard Team Obama tries to spin and get their surrogates to spin more and follow the spinning, bouncing ball, we're going to continue to expose what the administration wants to suppress. Starting now, if you haven't looked, watch the bottom of your screen, thanks to the Heritage Foundation, and you can see how much premiums are rising for average Americans. If you're 27 years old, if you're 50 years old, see how much your premium's going up. On average, men are seeing a 99% premium increase, women 62%, according to Forbes magazine. And joining me now with reaction, Tennessee Congresswoman Marsha Blackburn, Florida Congressman Ron DeSantis. Guys, good to see you. Congresswoman, how are you?
Good to see you. I'm well, thanks, Sean.
All right, so this is what I did on my radio show today. I called twice the number. First, we had a hard time getting through. Then we finally got through to the number the president tried to give us today. We get through. I mean, two very nice operators. They're probably going to be fired for talking to me, but they just said, well, go back to the website. So the toll-free number that the president gave to help you directs you back to the website that's not working. Only government can screw it up this bad, Congresswoman. Help us out.
You're exactly right. And $600 million plus all of the HHS staff that they have invested in this, and they continue to have all of these problems. It doesn't work. The president promised people that their insurance premiums would go down. They've gone up. He said if you like what you have, you can keep it. Not true, especially for those of us that have had health savings accounts. And they have a site that should have cost about $500,000 to build, not $500 million to build, and nobody can make heads or tails of it, and they don't want to come and just admit they made a mistake. It doesn't work. They've got a program that is too expensive to afford, and the system they're using to showcase it has been a failure. So we're looking for answers.
Congressman, I had a Harvard grad that I talked to last week. He said he could build a better system that could have all the capacity they need for less than $1 million.
That's right.
We spent $634 million. They had 3 years. If I'm the CEO of a company, Congressman, anybody that's given that much money and that much time that screws it up this bad is getting fired. Why isn't Kathleen Sebelius fired at this moment?
Well, thanks for having me, Sean. I think she should be fired. I mean, this is clearly just totally unacceptable. They've had over 3 years to do this. And I would say the president himself, 5 days before the website launched, said it would be just as easy as going to kayak.com and booking a flight. So this is yet another broken promise with this president and this health care law. Marsha mentioned the people losing their plans, which he said wouldn't happen. We just had 300,000 people in Florida who've had their plans canceled today because of Obamacare.
Yeah, on average, this is what I don't understand. Why, and Congresswoman, maybe this goes back to the heart of the debate we've had the last couple of weeks. If men are seeing on average a 99% increase, women a 62% increase, and we're putting it up there. Look at Delaware. If you're 27 years old, 99.9% increase if you're 27. Why aren't people demanding the savings that the president promised?
Well, and I think as people are getting their renewal notices, that is exactly what we're going to see between now and the end of the year. Obamacare started out to be an $863 billion access to insurance program for individuals that did not have that access. That's what they had said it was going to be, another broken promise. What it has become is a $2.6 trillion taking of the healthcare sector of our nation's economy, 17% of our economy. And this is what people are beginning to realize is you've got to pay for it somewhere. All of the mandates that are on our hospitals, on our physicians, on all sorts of our healthcare delivery, the cuts to Medicare, in order to stand this up, somebody's got to pay for it. There's no such thing as free. Yeah. And what we are seeing now is that it is unbelievable in the way that it is affecting every single portion of healthcare delivery and insurance in this country, and insurance is where people will see the impact first.
Jay Carney, Congressman, refused to rule out delaying the individual mandate today, which is all the Republicans in the House were asking for this whole shutdown. Is that a possibility at this late hour?
I don't see how you can have the IRS taxing Americans for failing to purchase a product off a government-run website that doesn't work. I mean, it's just not fair. We could have done this on September 30th. We would never have had a government shutdown had we been willing to delay the individual mandate. And guess what? That will actually save the government, according to CBO, $35 billion this year. No one's talking about a spending cut that big. To me, that's just a no-brainer at this point.
All right, guys.
That's right.
Appreciate you both being with us.